An ECG is a graphic representation of the electrical activity of the heart over time. It provides valuable information about the heart's rhythm, rate, and electrical conduction pathways. ECGs are commonly used in clinical settings to diagnose various cardiac conditions. An ECG uses the electrical impulses to create waveforms. P wave represents atrial depolarization or contraction. QRS complex represents ventricular depolarization or contraction, and atrial repolarization, which is relaxation. T wave represents ventricular repolarization or relaxation. PR interval is the time from the beginning of the P wave to the beginning of the QRS complex, indicating the time taken for atrial depolarization and impulse conduction through the AV node. QT interval is the time from the beginning of the QRS complex to the end of the T wave, representing the total time for ventricular depolarization and repolarization. ST segment represents the period between ventricular depolarization and repolarization. NSR is the normal rhythm of the heart originating from the sinoatrial or SA node. Characteristics include a regular rhythm, a rate of 60 to 100 beats per minute, and each P wave followed by a QRS complex. NSR indicates normal electrical conduction through the heart. Time is measured on the horizontal axis in seconds. Each small box is 0.04 seconds. One large box is 5 small boxes, which equals 0.20 seconds. 5 large boxes equal 1 second. 30 large boxes equal 6 seconds. Voltage is measured on the vertical axis. Each small box is 0.1 millivolts. One large box is 0.5 millivolts. Large square method. 300 large squares is equal to 1 minute at a paper speed of 25 millimeters per second. We can thus calculate beats per minute by dividing 300 by the number of large squares between each RR interval, which is the space between two consecutive R waves representing one beat. For example, 2 large squares between each RR interval implies a rate of 150 beats per minute. 3 implies a rate of 100 beats per minute, and so forth. Small square method. 1500 is divided by the number of small squares between consecutive R waves. For example, 10 small squares between RR interval implies a rate of 150 beats per minute. R wave method, or number of QRS complexes in 6 seconds. Rate equals the number of R waves on the rhythm strip multiplied by 6. The number of complexes, or count of R waves on the rhythm strip, gives the average rate over a 10-second period. This is multiplied by 6, as 10 seconds times 6 equals 1 minute, to give the average beats per minute. For example, 9 R waves multiplied by 6 equals 54 beats per minute. This method is useful for slow and or irregular rhythms. Determine heart rate using one of the methods from the previous slides. Determine regularity, whether it is regular or irregular. Assess atrial and ventricular regularity by looking at PP and RR intervals. Analyze P waves, checking if they are present, regular, consistent in shape, similar, and if there is one for each QRS complex. Measure the PR interval, which should be between 0.12 to 0.20 seconds. Measure the QRS duration, which should be between 0.04 to 0.10 seconds. Finally, interpret the rhythm using the information gathered. Atrial fibrillation, or AFib, is characterized by an irregular rhythm with no distinct P waves and a rapid ventricular rate. Atrial flutter shows a sawtooth pattern of atrial depolarization with a regular ventricular rhythm. Ventricular tachycardia, or VTach, presents with wide QRS complexes and a rate greater than 100 beats per minute. Ventricular fibrillation, or VFib, is chaotic and irregular, with no identifiable waves and no effective cardiac output. Heart block involves a delay or interruption in the conduction of impulses between the atria and ventricles, and it is classified as first degree, second degree, or third degree, which is complete heart block. Thank you all for watching this video. We truly appreciate your time and dedication as you prepare for your NCLEX journey. Remember, success comes with the right guidance and preparation, and we're here to support you every step of the way. If you're looking for expert coaching, whether online or live, visit bryceinternational.com to register for top quality NCLEX coaching. You'll also find valuable IELTS guidance to help you reach your goals. Stay focused, keep pushing forward, and believe in yourself. You've got this.